The 1848 Public Health Act was the first step on the road to improved public health. One of the individuals who played an important role in its creation was Edwin Chadwick, a social reformer. Whilst working as secretary to the Poor Law Commissioners, he investigated the issue of sanitation amongst the poor. In 1842, he published The Sanitary Condition of the Labouring Population of Great Britain. Chadwick's argument was economic, as he was convinced that if the health of the poor were improved, it would result in less people seeking poor relief. Much poor relief was given to the families of men who had died from infectious diseases. Poor relief was money to help the families.
Money spent on improving public health was therefore cost-effective, as it would save money in the long term. He considered that the most important steps to improve the health of the public were improved drainage and provision of sewers, the provision of clean drinking water, the appointment of a medical officer for each town. Edwin Chadwick was very influential in creating the first Public Health Act. However, the act was not very effective as, although it aimed to improve sanitation, it was not enforced and followed by the authorities and the public. This brought together a range of acts covering sewage and drains, water supply, housing, and disease. Its purpose was to combat filthy urban living conditions, including the spread of many diseases such as cholera and typhus. Reformers wanted to resolve sanitary problems, because sewage was flowing down the street daily. The worst affected areas were densely populated streets of big towns and cities. This was even worse due to the Industrial Revolution, which led to many people moving to cities for work. However, they had to face bad living conditions.
Authorities were obliged to provide clean water, disposable sewage, refuse and ensure that only safe food was sold. It gave them the power to ensure that homes were connected to the main sewerage system, and the Act forbade the building of new homes without such connection. Additionally, local authorities had the power to supply water and to compel residents to connect their houses to water supplies. So with the rapid urbanization that accompanied the Industrial Revolution, huge numbers of terraced houses had been built to accommodate the factory workers. Most of these were built to a high standard.